This presentation is of chapters 1, an introduction to health communication, and chapter 13, planning a health promotion campaign. The learning objectives are to define health communication and identify specific instances of health communication, to distinguish between biomedical and biopsychosocial models of health, to identify the benefits of studying health communication, and to describe current issues in healthcare today. In addition, in Chapter 1, we will define health communication, and patient empowerment. Just to see what you know and to get your attention from the very beginning, I put in some multiple choice questions. So number 1, which of the following best describes health as defined by the World Health Organization? A, healthy is the opposite of sick. B, if you do not have a disease or injury, you are healthy. C, health is a state of physical, mental, and social well-being. And D, health is an unobtainable condition of nearly perfect physical function. Number 2, what is the significance of defining communication as a process? A, meaning is interpreted in light of past and present experiences as well as expectations for the future. B, because they are part of a process, communication episodes have clear beginnings and endings. C, a person can be healthy today but sick tomorrow. It's hard to predict. D, the best communicators follow a set guide about what to say first, second, and so on. And finally, which of the following is most true of health communication techniques? A, cultural and personal expectations influence what is appropriate in any given situation. B, women and men should communicate differently. C, the best use of your time is to master a series of key behaviors that work well in every setting. D, it's never appropriate to laugh when a patient makes a joke about his or her condition. So we'll go through the answers to the multiple choice questions at the end of this chapter. So the definition of health communication we're using with this textbook, and the generally the best one I've seen, is the way we seek, process, and share information, health information. Health communication incorporates different techniques and tools from several disciplines: anthropology, psychology, marketing, and epidemiology, for example. In fact, as the Venn diagram below shows, it's a discipline which brings together social sciences, natural sciences, and the humanities. So while health communication is a blend of disciplines, there are only 2 main branches. And these branches are the interpersonal health communication, which means interactions between individuals in healthcare settings, and public health communication, which means persuasive media campaigns and the study of those campaigns. And so in interpersonal communication, you're really looking at rigorous methods to analyze individuals. And in public health communication, you're looking at rigorous methods to analyze populations and audiences in terms of public health and statistics. The biomedical medical model is the one that we all think of in terms of going to the hospital or getting treatment from a physician. And it's also based on a population and statistics and what's most likely to occur, just as is public health communication research and evidence. So the biomedical model is uses logically analyzed tests and observations and leads to treatment with well-established methods. But it's really not enough to help people feel like they're fully being treated. And so the biopsychosocial model has gained in popularity, and it's a more holistic approach to medicine, and it includes concern with individuals' thoughts and emotions as well as the physical conditions of illness. And interpersonal health communication, for example, incorporates more of the biopsychosocial model. Just to see what you know and to get your attention from the very beginning, I put in some multiple choice questions. So number 1, which of the following best describes health as defined by the World Health Organization? A, healthy is the opposite of sick. B, if you do not have a disease or injury, you are healthy. C, health is a state of physical, mental, and social well-being. And D, health is an unobtainable condition of nearly perfect physical function. Which of the following best describes health as defined by the World Health Organization? The answer is health is a state of physical, mental, and social well-being. What is the significance of defining communication as a process? Meaning is interpreted in light of past and present experiences as well as expectations for the future. So communication isn't something that just occurs at one time, and the idea of communication as a process is very important, particularly in health communication and the history of health communication, because previously it wasn't understood as a process, and the way that health information was and given and health campaigns were conducted didn't work as well. Which of the following is most true of health communication techniques? Cultural and personal expectations influence what is appropriate in any given situation. Moving on to Chapter 13. Planning health promotion campaigns. Just to see what you know and to get your attention from the very beginning, I put in some multiple choice questions. So number 1, which of the following best describes health as defined by the World Health Organization? A, healthy is the opposite of sick. B, if you do not have a disease or injury, you are healthy. C, health is a state of physical, mental, and social well-being. And D, health is an unobtainable condition of nearly perfect physical function. In addition, we will define focus group, social capital, segmenting an audience, activation model for information exposure, channel, which is just the means of communicating information, and elaboration likelihood model, as well as diffusion of innovations, which is a model describing how new information is carried through an audience. So let me define social capital right now. It's things that are beyond individual control, like prejudice, trust, community resources, social networks, and confidence in communication. So despite how communication may be going, because of this idea of social capital, the actual communication may or may not occur. So once more, to test your knowledge by taking a shot at these multiple choice questions. 1. Adolescent audiences are typically hard to influence because adolescents typically believe in personal fable. This concept is defined as the belief that they are unlike other people and others do not understand them, A. B, C, or D. 2. One problem with safer sex campaigns is that some people are drawn to risky behaviors. Portraying sex as risky may make it more appealing to blank who like novel and intense experiences. Are these A, hyper-imaginative people, B, stimulus-satiated people, C, electrostatic perceivers, or D, high-sensation seekers? 3. According to our book, all of the following are key principles in designing a public health campaign except A, know your audience, B, take action when words are not enough, C, appeal to as many people as possible in your message, or D, encourage social support for healthy behaviors. As mentioned previously, the history of health communication includes new notions about communication, and there's been a change since health communication started as a field in the 1960s from the idea that you can communicate just by giving out information. So that was the era of information, education, and communication. In other words, IEC. You'll still see this referred to for some campaigns. And then once there were a number of studies done showing that by changing levels of exercise and behaviors such as smoking and salt intake, people could avoid diabetes, heart attacks, many different conditions. And so then that became, in the late 70s, the era of behavior change communication, or BCC. However, even though people's behavior changes in terms of health, many times there's nothing, it doesn't, their health can't improve because the root of the problem is in society. And so there are a number of examples of this in chapter 13, and you'll be watching videos about this. And this current era is social ecology. It's often considered to be the era of the upstream causative factors. So the structures of society influence health. For example, social issues are sometimes more important than individual choices in determining people's health status. And health communication work needs to address issues of social equity, justice, community resources, and the environment. The ecological model of health developed by the Institute of Medicine shows how factors like societal influence and factors other than individual biology and behavior affect health. These are the upstream factors from the individual. And so in addition to societal factors, there are environmental living and working conditions such as global climate change, and which affects health for example, creating more vector-borne diseases. And then there are national and global laws, policies, movements, and emergencies. For example, wars can be pretty bad for people's health. Health communication incorporates different techniques and tools from several disciplines: anthropology, psychology, marketing, and epidemiology, for example. In fact, as the Venn diagram below shows, it's a discipline which brings together social sciences, natural sciences, and the humanities. So while health communication is a blend of disciplines, the measures mentioned on the previous slide have led to exemplary campaigns described in your textbook in Chapter 13. So there's the Truth Campaign, breast cancer awareness, a campaign at in Los Angeles beauty salons, and there was an action taken to remove whole milk from preschool lunches in New York City public schools. And then there was the Minnesota Heart Health Program and the 90-second intervention. The first steps of a health communication campaign are to define the situation, learn about potential audience members, segment the audience, select channels of communication, and multiple channels are recommended. In addition, we will define focus group, social capital, segmenting an audience, activation model for information exposure, channel, which is just the means of communicating information, and elaboration likelihood model, as well as diffusion of innovations, which is a model describing how new information is carried through an audience. So let me define social capital right now. It's it's things that are beyond individual control, like prejudice, trust, community resources, social networks, and confidence in communication. So despite how communication may be going, because of this idea of social capital, the actual communication may or may not occur. Step number 2, learn about potential audience members. Choosing a target audience. You should find those who do not already have the health information that you're persuading people to learn about, and you should find those who have the health problem in addition. So those are 2 good points for finding an target audience. And then in terms of your data gathering options, in order to find out more about the target audience, you can create an online survey or conduct a focus group depending on your organization. So the knowledge gap hypothesis relates to this selection of people who may not have access to the health information. Persons with plentiful information resources are likely to know more and to continue learning more than people with fewer information resources. New information often increases the knowledge gap rather than diminishing it. In terms of step number 3, segmenting the audience, you should identify groups within your audience who may have similar goals and experiences. So the idea is to stay away from grouping people according to superficial traits and rather Find out what their motivations are and segment the audience according to those factors. For example, there are many adolescents who have personal fables. In other words, they believe that they are unique and have their own individual story. And they have imaginary audiences, so they feel like somebody is always watching them. And then they have psychological reactants. And if they react against people telling them what to do, for example. And then another group is sensation seekers. So you could find out what part of your audience are sensation seekers and then have them as one of the segments. And so the activation model for information exposure indicates that persuasive messages work best when they stimulate an optimal amount of arousal. However, the optimal amount for one person may be boring to another, such as a sensation seeker. The elaboration likelihood model says that we pay more attention to messages about issues in which we're already involved. So finding people who are involved in a particular issue and reaching them through that issue can be helpful in health communication. And then in terms of narrowcasting, which can also be called tailoring, the meaning of this is custom fitting health communication to one person's needs based on information about that individual. So it's often based on constructs such as readiness to change and their health beliefs and their self-efficacy, as well as demographic and personal information. For example, if you go to a doctor's office and when you're leaving, you're given a custom health advice printout, that often will be tailored just to you based on a questionnaire you filled out at the doctor's office. So then there's broadcasting or targeting, which is the older kind of audience identification. So that's focusing on one group that has critical features in common, or using demographic, cultural, or other factors in your communication strategy to reach specific audiences.